anesthesia, and kind of like in life in general, is the question why. Why do we do anything? And in anesthesia, everything we do has an impact. It has an outcome, and there's a reason for what we do, and the reason that we do it is for the specific outcome. And why do we go to these skills workshops? We go to the skills workshops for continuing medical education to keep our licenses, but I challenge you to think that you come to the skills workshops because you want fulfillment. You want fulfillment in your work, and you want to make an impact because you take care of patients every single day, and their lives are in your hand. So, you know, you make a lot of money as anesthesia providers, and that's great, but it doesn't give you fulfillment. But when you do a really good job, and you have a patient, and you're able to give them an extraordinary experience, then you can leave work that day feeling really wonderful about yourself. So the skills workshop, just 3 little tasks that you can do at work, and then you can improve these tasks to just make it a little bit better. Because every time you add tasks to your tool belt and you pull that tool out and you use it, you get a little bit better in your job. First one, you have a suction tip. You know, patient's asleep, and all you're doing is suctioning their mouth. They've got saliva in there, and if you hold your suction tube as if it's attached to your arm, then imagine that this is the back of your mouth, the posterior pharyngeal wall, the mucosal lining. It's easy to lacerate. It's not very durable, right? And when you hold the Yonkauer like this, it's hard to tell how many pounds per square inch you have of force when you get back to the back of the wall. Use your fingertips, right? You have nerve endings here. You can feel things so much easier than you can with the palm of your hand. Put it in between your hands, and then gently move to the back. And you'll notice that you create fewer lacerations in the back of the mouth. Number 2, you have an oral gastric tube, right? Put somebody to sleep, they're asleep, they're relaxed, their jaw's open, and you want to put a tube in their stomach so you can get the fluids out while they're asleep. They don't know anything about it, right? So you open their mouth, right? You're looking in, and you have this little plastic tube. A lot of people will put it in there, it goes in the esophagus, it goes in the stomach. So what I implore you to do is to use your other hand in the back of the mouth, and you can feel the tube on the top side of your hand, right? And when you feel that tube there, you know that it's not going to go the other direction into your nasal pharynx. And that would cause a nosebleed, and nosebleeds can land you in the hospital for a day or 2, right? So that's one thing that you get out of that. And the next thing is being anatomically conscious of what you're doing with the OG tube, right? So imagine you're looking straight down and you have the esophagus right here. And then above that you have the trachea, you have your 2 vocal cords. That's where your breathing tube is, right? You got some cartilage here, and right here, you know, you have these mucosal flaps, right? And that's like the big picture of the tiny little thing going on down here. And these little flaps on the left and the right, as you place this OG tube, if you get resistance shallow, 10 centimeters or so deep, then more than likely you're off to the left or you're off to the right. So you just have to pull it back, readjust, look at your midline, and re-advance. And gently re-advance it. And without resistance, you won't create lacerations to the mucosa. You won't cause any bleeding in the back of the mouth. And the last little thing is what you do with the OG tube when it's in place. In the ICUs, we all know that you do low intermittent wall suction. Low means low pressure, intermittent means on and off, wall suction means the tube is in the stomach and you're getting some fluid passively off. And then if you turn it all the way up, the suction power, it pulls all this pressure, right? All this pressure at the end of that tube, and those little holes at the end of the plastic capsule can get sucked to the side of your stomach. And if it gets stuck to the side of your stomach and you have all this pressure pulling back, then you can create like an ulcer in the stomach that can cause pain and it can cause bleeding. So it's so much easier to suck the stomach out, put it to low intermittent wall suction, and or just put it to passive gravity drainage. And those are the 3 tools that you can take and increase your tool belt so you can have a great experience with your patients.
All right.